Well, welcome back. We're still with Dr. Mwachonda, who is the Secretary General of the KMPDU, the medical body that has decided to issue that strike notice should the government fail to heed those demands. So let's pick up from where we left off, where you have faulted the Health CS and PS, and you've talked about their mission and commission. So going into this, and you've called on the President to take the lead in it, but nonetheless, you can imagine negotiation would be done by administrators. Are you willing to be at the negotiating table with them?
Negotiations we shall engage in. That is very clear. You see, the issue is this, that the President issues directives on the welfare of healthcare workers, but those directives need to be implemented by the people he's put in office. When the people he's put in office are not addressing the concerns and are not working as per those directives, then there is a problem. And that is where we come in and we say that there is that problem. Negotiations we will engage in. I think this has been the most difficult decision for the union. We're in a pandemic. Everyone's at risk, including our members. But what has transpired over the last 8 months, but more so over the last 2 months, where we've had the highest number of infections amongst healthcare workers and mortalities, and healthcare workers are basically working without PPEs. And let me say that it was through the directive of the President that the Kenya Emergency COVID-19 Fund was created. And in that fund, we were incorporated into it. And we've worked very closely with that fund. And I'd like to thank the chair, Madam Jane Karuku, and the chair of the health committee of that fund also, Dr. James Mwangi of Equity. They've worked with unions, and I can tell you for a fact that they know how much we've been able to put in just to protect our people. But on the flip side, on the government side, you have a government, counties, and the ministry who decided that they're not going to put in any funds to procure PPEs. The PPEs in the COVID fund are for the 68 isolation and treatment centers. So the rest of the facilities require PPEs from the ministry and county governments. And so when these two entities come and say you have enough PPEs, they are referring to the Emergency COVID-19 Fund, not to PPEs provision in these other facilities. To us, that is abdicating the responsibility of protecting the welfare and safety of the healthcare workers. And this is the discussion we wanted to have on how do we protect our members on the front line.
Let me ask you this, and I know it can be difficult to quantify, but if you would, what kind of shortfall are we looking at for health workers in as far as PPEs are concerned? Is there any way you can put a number to it?
Putting figures to it is very difficult because how PPEs work, depending on the level, if I have a mask in the hospital and it gets soiled, I cannot continue working with that mask. I have to change. If I'm on a surgical gown and it gets soiled, I have to change that. But more importantly is that beyond the PPE issues, there are so many issues that health workers have grappled with during this time of the pandemic.
Right, and we'll get to them, but just before that, because we've had questions coming in from our viewers as well, specifically regarding PPEs and much more, because we know that KEMSA in their stores have stock worth 6.2 billion shillings worth of PPEs. That is apparently now subject of an EACC investigation. Supplies have not been paid, so that this cannot be released. What do you make of that, amidst the real need of medics to have this equipment?
Yeah. The whole issue of KEMSA and the COVID millionaires arose in August. So you've had September, you had October, those are 2 months, and now in November, mid-November, moving towards the end of November. So yes, they are subject to to an investigation. They are procured under circumstances that are deemed fraudulent, we'd say, given the information that is there. That's why there's an investigation ongoing. But even as we are in that situation, counties are decrying that they will not buy these PPEs. The ministry has sat on them. So you have PPEs, you have a shortage of PPEs. Not easy decisions, but what does that mean? That means that essentially a decision should have been made, because even if you conclude the investigations, beyond even the timelines that are already issued, those PPEs will require to be used.
What are you saying? Should the president issue a directive on it? Should they simply, suppliers be paid regardless of the cost, and this equipment given to doctors now?
Those charged with the responsibility of procuring PPEs and protecting healthcare workers were officials of government. If they add, and if they undertook fraudulent means, then the same government should make a directive and issue those PPEs to healthcare workers. So it's no longer an issue of cost here, it's an issue of lives that need to be saved.
Right. So you're saying President Kenyatta should have that released to doctors unilaterally without the government incurring any payments?
I believe it is in his interest to protect his frontline soldiers, to make a decision on how those PPEs will get to healthcare workers in the soonest time possible.
Okay. The president recently rolled out the universal health coverage. In response to that, you said, and I want to quote you, "You can have all the equipment and machinery in the world, but without qualified workers, it won't work," end quote. And you have also lamented in the same breath that focus on COVID-19 is skewed towards just what we've been talking about, procurement and pilferage of resources at the expense of health staff. If the president were watching this program right now, what would you want him to know about his healthcare plan and the management of COVID-19 in the country?
First and foremost, we don't lament as a union. We say and bring issues on the table that need to be addressed. So it's not lamenting. Universal health coverage has 4 pillars, and one of the pillars is human resources for health. And the human resources for health need to be well-trained, well-motivated, for the workforce to be efficient. But the story in our country is different. You have governors in Laikipia and Kirinyaga who fired workers unprocedurally. You have doctors at the Ministry of Health being paid less what their counterparts in the same ministry are being paid by doing the same work. We've seen adverts of universal health coverage where those hired under UHC plan are paid 70% of what the other doctors and healthcare workers are paid, and yet they perform the same job. So what message are we passing? Because you're making people work for less and expecting them to give you 100%, it is not possible. So universal health coverage is a very good agenda. We have supported it right from the start. We have given our input, which was considered initially. But there's been a very interesting shift on procurement at the expense of the human resources for health. And I'm not saying that supplies and equipment is not important. It is important, but it must be given the same priority as the health workforce. Because without a health workforce, you will go to hospitals that are fully equipped, well equipped, but there'll be no one to attend to you as a patient. Universal health coverage is supposed to ensure that the Kenyans and the citizens of this country have access to healthcare, high quality healthcare, at an affordable cost. Now, in the pandemic, we have seen the ministry coming out clearly that you're all on your own. Not just doctors, but the entire citizenry. Look at other governments across the world. They have ensured that they're protecting their citizens. For the first time, we've seen that the Universal Social Protection Program has been given a lot of weight in the entire globe. So Kenya cannot say you're implementing universal health coverage, but you're missing out on the basics. And the basics is the people who are tasked to ensure that it aligns with the vision of the leader who said, I want universal health coverage.
Right, let me ask you this. So you saw recently a wing, a dedicated wing, if you like, of the Nairobi hospital being opened by the president, ostensibly to cater for a certain section of, you know, the foreign, if you like, service corps in the country. What did you make of that?
It's an effort that was undertaken, I think, by the private sector and international organization to protect its staff. The resources were put in, and within the shortest time, we've seen a very big wing that will cater for a specific part of the population. And so the question is, and not to me, one, what about the healthcare workers who are on the front line not getting a similar? Because right now, the doctors we've lost, I'll tell you, when I said earlier that the doctors have died awaiting ICU, one of the doctors was being asked to pay for air evacuation from where they were at a cost of 600,000, and they didn't have that. So the irony is, where exactly are we putting our priority? And I'm not saying they should not set up that. They should. But equally, your frontline healthcare workers require such, because they're being failed by the same system that they've worked in for years. Yeah.
Let's talk a little bit about the pandemic itself. In your opinion, how accurate would you say are the numbers we receive from the government in their COVID-19 briefings? Do we now have a clear picture of the disease burden in the country?
Our testing has been suboptimal right from the start. If you compare our country's testing capacity, the number of tests conducted per day, and other countries, even in Africa, that have scaled up, and other governments that have equally undertaken to ensure that their citizens are tested for free. You know, there are foreigners who've come into the country and they're asking, there's no free testing. I mean, and this is not just the foreigners, but it's something that happened across the globe. So we've never had, we initially had for a short period, we've never had an opportunity to test those that really require the testing. So the disease burden is not the true picture because of the suboptimal testing. And that is why your people are shocked now that people are dying, but it's because we never tested enough. In fact, in August, September, we were doing very minimal testing if you look at the number of tests that were being conducted. Until we got a donation, and now the number of tests increased. So the reality is that
so those numbers are really...
We are faced with a disease that we do not have a very clear picture to say that this actually is the correct situation.
Right, but perhaps there's a clearer picture from hospitals. What is the state of hospitals across the country right now?
So for COVID, you have those who do not require hospital admission and those that require hospital admission. And those that require hospital admission shift very fast to being severe disease, to severe disease. I can confidently say, this is from information I know from my colleagues who work in all these ICU centers, that the ICU centers are full.
Everywhere?
Yes, and if you were to require ICU space, you will struggle. I've struggled myself for the last 72 hours to get people who are close to me those spaces, and they've died. So it's real that our ICU capacity needs to be increased, and for healthcare workers, they equally need that.
Do you think healthcare workers require a dedicated space, the same way in which we've seen that Foreign Service Corps getting their own space?
And one of the things we've put forth right from the start, and now we've said it must be done, in each county there must be a dedicated facility for healthcare workers, complete with ICUs, and at the national government equally, so that we do not see what we are seeing, because the number of healthcare workers who are infected and moving to severe disease is increasing. And if nothing of that sort is done, then what you're going to see, I don't even want to talk of that grim picture, because it is one that, as a doctor, you don't want to imagine that you're seeing doctors and your colleagues dying because they have no access to treatment, because there's no ICU space.
Right. But what do you say to those who say tall order? The president gave such duration of time for counties to sort of get their act in order to get, I think, to the 300-bed capacity, and they still weren't able to meet that. Leave alone now ICU facilities, which would require specialized equipment as well. All of this again happening when we are in what we don't want to call, but is an economic crisis. There simply isn't the money. How realistic, and I beg your pardon for even just using the term, how realistic are the demands of doctors in this economy?
Let me say this. There are resources. I think there are resources to do other political activities, but there are no resources to combat COVID to the extent that we require. And that is where the problem comes in. Let's be real. That
priorities.
You can't be in a pandemic and not put in enough resources. And where even resources have been put into COVID, we've gotten pilferage and corruption in it. So you can't justify. So there was money to say you're putting in a pandemic to steal, but there's no money to put in the pandemic to take care of your frontline healthcare workers. That's the question.
Let's ponder on it and go to break, I think. We'll take a short break and we'll return with your final thoughts after this.